Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, you have a malady. You have a problem. And we're going to show you how to help you with that thing today.
Okay, we're talking about spondylolisthesis or
Right.
how do you pronounce it, Bob?
Spondylolisthesis.
Right. However, it's a big long term.
Spondylolisthesis.
And
yeah.
if you have it, you probably know it, although 10%, it's estimated 10% of the population has some degree of this.
And don't even know it.
Right, some of
Sure.
them don't. Me personally, I do have it. I definitely know I have it. You can see it on the x-rays and I can feel it and I have symptoms. I've learned how to self-treat it, and that's what I want to teach you how to do.
Excellent.
Okay, from personal experience as well as some patients I've worked with.
That's wonderful.
So what is spondylolisthesis? We're going to look at the back, and it's usually in the low back. Okay, so we're talking right about at the belt line. Mine is between L4 and L5. It's a common place for it. And if we
vertebrae here.
Right, we're going to look at those two lumbar vertebrae. And what happens is, it's kind of interesting, a fracture occurs in the back part of the bones. I'm not going to get into the detail, but
Right.
what happens is one vertebra shifts forward and it becomes misaligned, and that can cause some problems.
Oh, lots of problems.
Yeah. So
You
if
want to show them on the cups here.
yeah, we're going to use a model. This vertebra cup represents L5. Why don't you show them where that is on there, Bob?
L5 is right here, and this is L4.
Right.
He's going to show those two.
Now, if you look at your vertebrae, they should be lined up like this. Between, there's going to be a disc, although in mine, the disc has disappeared over time. So they oftentimes do come together, and there's a shift forward, an actual misalignment.
Yep.
Okay, there's grade 1 through grade 4. Okay, we're not going to get into that, but if you do have this, you have a shift like this, there's some exercises you can do to help improve this and keep it stabilized. I shouldn't say improve it, but at least
Probably stop it from getting worse,
right,
progressing.
as well as manage pain.
Right.
And that's what I've discovered. It works very well.
Because you're a very active guy, Brad, and
Right.
yet you're getting by with this. And what is your stage, or what level?
I'm
is yours?
between a 1 and a 2.
1 and a
1 and a
2,
half
okay.
to 2, right.
So-
Stage 4 is the worst. If you're at stage 4, you're probably having surgery. We don't even want to think about going
Yeah.
there. So if you haven't done any exercises this before, if you look at the vertebrae and they're shifted, we want to keep them stable by strengthening the core, primarily abdominal muscles. We're going to flex things, okay? Thank you, Bob. So the first thing you're going to do is learn how to do a pelvic anterior tilt, or posterior tilt, I'm sorry.
Yep.
Get my tilts in gear, and that is this.
So if you watch his belt line here, which you can't see too well, but his belt is actually flattening. I mean, maybe it'd be better if I just put my hands here,
Yeah,
Brad, right?
I'm going to squish his
my
hand.
hand, yeah.
There we go. I'm tilting my pelvis this direction, tightening those stomach, and you're going to do 10 to 15 of those. Some people have a hard time doing this if you never did this before.
Yeah, a lot of people have a lot of poor
Yeah,
self-awareness.
put your hand back there and think about squishing your
hand,
fingers
yep.
into your back, okay? Then once you do 10 to 15 of those and you feel comfortable with doing that, the next thing you're going to do is you can cross your hands like this and simply do a little crunch or a little sit-up. You don't have to go way up like this. As a matter of fact, I don't want you,
don't
to do
want
that.
to do that, no.
We want this.
And should your pelvis be pushed down while you're doing this,
Yes,
Brad?
good point, Bob. I'm going to push down.
So he's going to,
Yep. Going to round that
gonna
back out.
stabilize that back before he does this.
Okay, now we're going to come at it
How many
from
repetitions, Brad?
10 to 15.
Okay.
If you haven't done this before, 10 or 15, you're going to feel it, and
Right.
you're going to take a while to get in the shape. I like to go up to 50. The goal is to get up to 50.
Okay.
Because you want to have a real strong core, but that may take a month or two if you haven't done it.
Sure.
Then the next thing you're going to do is lay here, do the
Pelvic tilt.
pelvic tilt, lift one knee up, and then the other one, and do 10 to 15 of these while you're
Keeping the pelvic tilt.
pushing your back down into the table.
That's why it's so important to learn that pelvic tilt.
Right. And you should do this on a carpeted floor or a firm table, not a bed. Okay? Then the next thing you're going to do is, if you can,
This is a little more aggressive.
both knees up at
Yeah.
the same time. If you're an athlete already in shape, I'm going to have another video to show you some more aggressive things you can do so you can keep your activities up at a good level. Okay?
So again, he's doing the pelvic tilt the whole time while he's doing the leg lifts here.
Right.
Pretty difficult to do. Brad makes it look easy.
And the last one, arms like this again, knees up, and you're going to take your right elbow towards your left knee. And then this one's a little difficult at first too, but once you get used to it, you'll do fine, okay?
Just a gentle twist, very little
Right.
at all.
But this helps get the oblique muscles. It just is a kind
Right.
of puts a final strap on the core strengthening.
We don't want
in
a
that
huge
flexion.
twist, and we don't want a huge flexion, but he's just barely coming up.
Exactly.
So-
So once you get going with this, you'll be able to get through this in less than 5 minutes easily. As you get better at it, you'll add repetitions. It may take 10 to 15 minutes possibly, but that's about it. And there's a couple other things you really need to absolutely avoid if you have this condition, and that is overhead work like this, like washing the ceiling. Okay, if you're doing work on the ceiling where you're extending backwards, you don't want to do this exercise very much. You do not want to do, even though this is a good back exercise for most people,
That's a bad one for you.
right, you don't want to do this extension exercise. Okay, we want strength here, and it's a little unusual in that sense, but you'll do fine. It will definitely help you out. So
Make sure you subscribe if you haven't already.
take care.
Brad, the two most famous physical therapists.